There is a forgotten Korean root that ends joint pain and repairs aging skin, and your doctor has never mentioned it. Her name was Mrs. Park. She was 67 years old when she came into my emergency department for the third time in 18 months. Not a cardiac event, not a fracture, chronic joint pain that had stopped her from sleeping, and skin on her forearms that had thinned and inflamed to the point where her grandchildren were afraid to hug her. Her rheumatologist had her on daily ibuprofen. Her dermatologist had given her a steroid cream. 2 separate doctors, 2 separate problems, 2 separate prescriptions, and she was getting worse, not better. What none of her doctors had told her was that the joint pain and the skin changes were coming from the same place. That's what today is about. Don't look at the joint supplement aisle. Look at what's driving the inflammation in the first place. Here's the assumption almost everyone over 60 is carrying right now. Joint pain is a joint problem, and aging skin is a skin problem. They get treated separately because they look separate, but underneath both of them is a single biological process that accelerates after 60A master switch inside your cells that gets stuck in the on position and begins broadcasting an inflammatory signal to your joints, to your skin, and to virtually every tissue in your body simultaneously. You are not dealing with 2 problems. You are dealing with 1 problem, showing up in 2 places at once. And here is the silent threat. That master switch is already running in your body right now. You don't feel it as inflammation. You feel it as stiffness when you wake up, as joints that take 20 minutes to loosen, as skin that looks older than it should and reacts to everything. It started years before the pain became noticeable. It is progressing right now. And the standard approach, a daily joint supplement, a surface moisturizer, addresses neither. By the end of this video, you will know exactly what Korean root preparation turns that switch off, what dose to use, what to pair it with so your body actually absorbs it, when to take it, what happens in the first week versus week 12, and what to do if you are on blood thinners, diabetes medication, or daily anti-inflammatory pills. Most people will never hear this from their physician, not because your doctor is withholding anything, but because this root cannot be patented as a pharmaceutical compound. When Korean and international researchers began publishing clinical data on its active compound, there was no mechanism for a drug company to own it, no financial incentive to fund the large-scale trials that move a compound into Western treatment guidelines. Without guidelines, physicians don't recommend it, and a root Korean grandmothers have brewed as daily morning medicine for centuries gets quietly dismissed as folklore until a review of 15 separate clinical trials covering 1,621 patients makes the dismissal impossible to sustain. Here is the fact that changes how you see this entire problem. The same biological switch that tells your knee to swell and ache is the same switch that tells your skin to thin, inflame, and age faster than it should. They are not separate systems. They are 2 symptoms of 1 signal, and the compound that turns that signal off has been sitting in Korean grocery stores, on Jindo Island, in Korean grandmother's morning tea, for longer than Western rheumatology has existed. Hi, I'm Dr. Sarah Kim. I'm an emergency medicine physician with a background in preventive care. And after 15 years working at that intersection, seeing patients arrive in crisis and watching others sidestep it entirely, I became deeply interested in one question. What are the people who stay healthy into their 70s and 80s actually doing differently? The answer, more often than not, traced back to something specific about Korean dietary and morning traditions that Western medicine has almost entirely ignored. What I kept finding when I traced those patterns back was the same cluster of compounds. And one of the most consistent ones, something I'd never been taught in medical school, was a compound found in a traditional Korean root that researchers have now studied across dozens of clinical trials. The data wasn't in any guideline I had trained on, but it was there, in peer-reviewed journals, waiting for someone to read it with fresh eyes. Before we go further, nothing in this video is medical advice. I'm sharing peer-reviewed research so you can have an informed conversation with your own physician. If you're on medication or managing a diagnosis, please loop in your doctor before making any changes to your routine. In this video, I'm going to show you what Korean ulgeumm is, where it comes from, and why the Korean preparation tradition is medically distinct from anything you've seen before. The exact biological mechanism, how one compound suppresses the master switch, driving both joint pain and skin aging at the cellular level. The specific research, how many participants, how long the trials ran, and what measurable results were confirmed so you can verify every claim yourself. An exact daily protocol with dose, preparation method, timing, and what to pair it with so your body actually absorbs it. The preparation mistakes that eliminate most of the compound's effectiveness before it ever reaches your joints. What to do if you're on blood thinners, diabetes medication, daily anti-inflammatory pills, or if you have active gallstones, because knowing who needs physician clearance first is what separates credible information from hype. And the honest timeline, what some users feel in the first week, and what the clinical evidence actually confirms at 12 weeks. Imagine a circuit breaker in your home's electrical panel. In a healthy house, that breaker trips when there's a surge, it stops the damage, resets, and goes quiet. Now imagine that after 60, that breaker gets stuck in the tripped position permanently. It never resets. The alarm keeps running. Your body keeps flooding your joints and your skin with inflammatory signals, not because there's an active threat, but because the switch that should turn the process off has lost its ability to respond. That stuck circuit breaker is a master switch inside your cells, the master switch that triggers inflammation throughout the body. In a young, healthy body, this switch activates briefly when you need it to fight infection, to heal an injury, and then shuts off. After 60, chronic low-grade activation of this switch becomes the default state for many adults. It is mostly invisible. You don't run a fever. You don't see swelling. You feel it as stiffness in the morning, as joints that ache by afternoon, as skin that looks more inflamed and ages faster than it should. The active compound in Korean ulgeumm curcumin does something very specific. It blocks the activation of this master switch, not by suppressing your immune system broadly, by interrupting the signal that tells the switch to stay on. In plain language, curcumin tells the stuck circuit breaker to reset. A Korean research team at one of Korea's leading clinical institutions conducted a review of 15 separate clinical trials covering 1,621 participants adults with osteoarthritis joint pain, and found that curcumin and Korean turmeric extract significantly reduced joint pain, joint stiffness, and physical function loss compared to a group taking a dummy treatment with no active ingredient. What that means for you. Across 15 trials and more than 1,600 real people, this single compound consistently reduced the joint inflammation that limits movement and disrupts sleep. The research team noted that the results were comparable to standard non-prescription pain medications with fewer side effects. The recommended duration for measurable benefit, 12 or more weeks of daily use. The same master switch that drives joint inflammation also drives the type of low-grade skin inflammation that accelerates visible aging after 60. Think of the skin's surface layer as a fence. When young, that fence is well maintained, the posts are tight, the material is flexible. After 60, chronic activation of the master inflammation switch begins degrading the proteins that hold that fence together. The skin thins. The barrier breaks down. Redness, reactivity, and accelerated visible aging follow. Curcumin suppression of that master inflammation switch interrupts this process at the source, not at the surface, but at the cellular level where the degradation signal originates. An 80-person clinical trial, pitting curcumin combination against chondroitin sulfate, the standard joint supplement most physicians recommend ran for 12 weeks. The curcumin group showed a reduction of one key inflammation signal in the blood by 54.52% from baseline, and a reduction of another inflammation signal that drives both joint pain and skin, aging by 59.08% from baseline. In plain language, curcumin reduced two of the core inflammatory signals, driving both joint pain and skin, aging by more than half over 12 weeks, and outperformed the standard joint supplement on both measures. Here's the mechanism that determines whether any of this actually works in your body. Curcumin is fat-soluble. It dissolves in fat, not in water. If you take it in plain water with no fat present, most of it passes through your digestive system without being absorbed. Think of it like a vitamin D capsule dissolved in a glass of water with no meal. The compound is present, but your body cannot capture it efficiently. The second obstacle is rapid breakdown in the digestive tract. Curcumin is metabolized quickly before it reaches your bloodstream. Black pepper contains a compound called piperine, a small molecule that acts like a gatekeeper, blocking the enzyme that breaks curcumin down before absorption and increasing how much your body actually absorbs by approximately 20-fold. In plain language, curcumin without black pepper and fat is a fraction as effective as curcumin prepared the Korean way with both. This is not a folk tradition. It is the biochemical reason Korean grandmothers were right. And this is where the centuries-old Korean morning ritual and the 15-trial clinical evidence meet in a single cup. This is the Korean ulgeumm morning protocol. All three components below are taken together as a single morning drink with breakfast. 1. Korean ulgeumm powder. 1 teaspoon, approximately 1 to 1.5 grams, in 250 milliliters of warm water. The water temperature matters. Approximately 175 degrees Fahrenheit, 80 degrees Celsius. Warm enough to dissolve the powder fully, not boiling. Boiling water can degrade heat-sensitive compounds. Stir vigorously for 30 seconds, or use a small frother. Ulgeumm powder does not dissolve easily and will settle if you don't mix it thoroughly. Source: look for the Korean term on the label and a Jindo Island origin statement. Available at H Mart in the spice or tea section, Korean tea importers and Jindo Island tea retailers online. Do not substitute Indian turmeric powder from the grocery store spice aisle. The cultural anchor and preparation tradition of this protocol are specifically Korean, and the Jindo Island ulgeumm kultivar is the variety used in Korean hanbang practice for joint and skin inflammation. 2. Black pepper. 1 small pinch, approximately 1/16 teaspoon, freshly ground. Add it directly to the warm ulgeumm water before drinking. This is non-negotiable for absorption. Without it, how much your body actually absorbs of the curcumin compound drops dramatically. The Korean tea tradition has included this pairing for centuries. The research confirms why. 3. A small amount of healthy fat. 1 teaspoon of MCT oil, coconut oil, or a splash of whole milk stirred into the drink. Curcumin is fat-soluble. Pairing it with fat improves how much your body actually absorbs, beyond what black pepper alone provides. Korean tradition pairs ulgeumm tea with a small Korean rice cake. The fat in the rice cake serves the same absorption function. Use whichever form works for your morning routine. Timing. Take this drink with breakfast, not on an empty stomach. Curcumin can be irritating to the stomach lining for some people, particularly on an empty stomach, or if you have a history of acid reflux or gastritis. Consistency. Some users notice their joints feeling looser and less stiff within the first 1 to 2 weeks of daily use. That early ease is real, but it is subjective. The measurable joint pain reduction confirmed by the clinical evidence, the 15-trial review, and the 2 supporting trials was measured at 12 weeks. This is not a 1-week fix. It is a 12-week commitment to a daily morning ritual that works progressively. Plan for 12 weeks. Notice what changes in week 1 or 2. Know that the data behind you runs 12 weeks deep for osteoarthritis grade joint pain. If your joint pain is significant and you want to match the dosing range studied in the clinical trials, a supplemental curcumin extract, standardized to 95% curcuminoids, typically 500 milligrams twice daily, may be added alongside the daily tea under physician supervision. Discuss with your prescribing physician before adding the supplemental form, particularly if you are on any of the medications listed below. Who needs to consult their physician before starting this protocol? Warfarin, rivaroxaban, apixaban, or any other blood thinner. Curcumin has documented mild properties that affect blood clotting. This is not a hand wave. This is a real interaction that requires your prescribing physician's review before you begin daily oral curcumin or daily ulgeumm tea. Daily NSAIDs, ibuprofen, naproxen, aspirin. Curcumin may enhance the anti-inflammatory and blood-thinning effects of these medications. If you are already taking a daily prescription anti-inflammatory, discuss combining them with your physician before starting. Diabetes medication, metformin, insulin, sulfonylureas. Curcumin can lower blood sugar. Monitor your fasting glucose readings during the first 4 weeks of regular intake and flag any unexpected drops to your physician. Active gallstones or bile duct obstruction. Curcumin stimulates bile flow. Do not begin this protocol until you have cleared it with your physician. Iron supplements or iron deficiency. Curcumin may bind iron at higher doses. Separate your iron supplement from ulgeumm tea by at least 2 hours. Upcoming surgery. Discontinue concentrated curcumin supplements 2 weeks before any planned procedure due to the mild effect on blood clotting. Turmeric or ginger family allergy. Rare but documented. Start with a very small amount before committing to daily intake. GERD or active gastritis. Start at half the dose, half a teaspoon, instead of a full teaspoon, and increase gradually, only if well tolerated. No documented clinically significant interactions have been found with statins, calcium channel blockers, ACE inhibitors, or thyroid medications at the doses used in this protocol. Pregnancy. High-dose curcumin extract supplements are not recommended during pregnancy. The daily ulgeumm tea at culinary doses is generally considered acceptable, but consult your OB/GYN before beginning. Chronic kidney disease. High-dose curcumin supplements increase oxalate load and are not recommended for patients with CKD or a history of kidney stones. Confirm with your nephrologist before use. Active chemotherapy curcumin has documented interactions with several chemotherapy agents, including cyclophosphamide and doxorubicin. If you are in active treatment, do not add curcumin extract without your oncologist's explicit approval. Mistake 1. Using Indian turmeric powder from the grocery store spice aisle. This is completely understandable. Turmeric is turmeric, right? But the cultural frame and preparation tradition matter here. Indian turmeric is designed for curry high heat, long cooking, food pairing. Korean ulgeumm is specifically the Curcuma longa cultivar, grown on Jindo Island and traditionally brewed as a daily morning tea at lower temperatures for joint and skin inflammation. The curcumin content and concentration can differ significantly between bulk grocery store turmeric and Jindo Island ulgeumm prepared for tea. The fix. Source specifically from Korean grocery stores or Korean tea importers. Look for on the label. Look for Jindo Island origin. The cultural specificity is also the quality anchor. Mistake 2. Skipping the black pepper. This is the most common reason ulgeumm or turmeric-based protocols fail to produce results. People read about the compound. They start taking it faithfully every morning and they notice nothing. The reason, almost always, is that without a small pinch of black pepper in the preparation, how much your body actually absorbs of the curcumin drops by a factor of approximately 20. You are taking the compound, but your body is not capturing it. The biological consequence is that the master inflammation switch never receives a sufficient signal to change its behavior. The fix. Add approximately 1/16 teaspoon of freshly ground black pepper to every cup. Not black pepper extract capsules whole freshly ground black pepper in the tea, as Korean tradition has always prepared it. Mistake 3. Taking it on an empty stomach. Curcumin is fat-soluble and can be irritating to the stomach lining, particularly in people with any history of acid reflux, gastritis, or sensitive digestion. Taking ulgeumm tea first thing in the morning on an empty stomach, the way many people approach a detox drink, bypasses the fat pairing that makes absorption work and increases the chance of stomach discomfort that causes people to stop the protocol entirely within 2 weeks. The biological consequence is that curcumin passes through your digestive tract, largely unabsorbed while simultaneously irritating the stomach lining, producing the worst of both outcomes. The fix. Always take ulgeumm tea with breakfast. Add a small amount of fat, MCT oil, coconut oil, or whole milk to the preparation. Never take it fasted. Mistake 4. Stopping at week 2 because you don't feel different yet. This is where most people quit, and it is the mistake with the highest cost. The research behind this compound measured outcomes at 12 weeks. The 15 trial review of 1,621 participants ran 12 weeks. The head-to-head trial against the standard joint supplement ran 12 weeks. Some users do notice their joints feeling less stiff in the first 1 to 2 weeks of daily use, and that early ease is real, but measurable. Confirmed joint pain reduction and the significant drop in inflammation signals in the blood happened at 12 weeks, not 2. The biological consequence of stopping at week 2 is that you have completed the warm-up and never run the race. The fix. Treat the 12-week mark as the measurement point. Take note of how your joints feel in weeks 1 and 2. Keep the morning ritual through week 12. That is when the data says the compound has had time to work. The master inflammation switch exists in your body right now. The cells in your joints that are sending the stiffness signal, and the cells in your skin that are responding to that same signal, they are present in you right now. The question is not whether your body can do this. It can. The question is whether you are giving it what it needs. 1 morning tea, every day, with black pepper, with a small amount of fat, with breakfast. That is where it starts. Stay with me for 1 more minute, because what follows is the specific sequence most people never connect. It is why this works when daily ibuprofen does not. Here's what we covered today. After 60, a master inflammation switch gets stuck in the on position and drives both joint stiffness and accelerated skin aging simultaneously from the same biological source. Korean ulgeumm, the curcuma longa root, cultivated on Jindo Island and brewed as daily morning tea in Korean hanbang tradition for centuries, contains a compound that blocks this switch. A review of 15 clinical trials covering 1,621 participants confirmed curcumin significantly reduced joint pain, stiffness, and physical function loss compared to a dummy treatment group with effects comparable to standard non-prescription pain medications. A 12-week head-to-head trial showed it outperformed the standard joint supplement on 2 key inflammation signals in the blood, reducing them by more than half. You prepare it as a morning tea. 1 teaspoon of Jindo Island ulgeumm powder, a pinch of black pepper, a small amount of fat, warm water at 175 degrees Fahrenheit, 80 degrees Celsius, with breakfast. 12 weeks of consistency is the clinical standard. Some people notice their joints feeling looser in the first week or 2, and that early ease is real. Mrs. Park started her morning ulgeumm tea 4 weeks after that 3rd emergency visit. By week 6, she told me she had slept through the night for the first time in 2 years. By week 12, her dermatologist reduced her steroid cream to as-needed use only. What her grandmother had called her morning root tea, something Mrs. Park had grown up watching her prepare every day in the kitchen before dawn, turned out to be the thing 2 separate specialists had missed. "My Halmoni knew," she said. She always knew. If this information was useful to you, share it with someone in your life who is dealing with joint pain or skin inflammation after 60 and hasn't found an answer yet. That is how this kind of research reaches the people who need it. And if you want to keep receiving this kind of evidence-based research on Korean health traditions, the compounds, the mechanisms, the clinical data that Western guidelines haven't caught up to yet, subscribe so you don't miss what's coming next. Next week, I'm covering a Korean preparation that does something entirely different. It doesn't just reduce inflammation. It works on a process inside your cells that most people over 60 have lost almost entirely. Scientists confirmed it in human trials. It has been in Korean kitchens for generations. And it may be the most overlooked morning habit for cellular longevity in the research.